That will be.
Have you ever visited a hospital and spent more than 30 minutes waiting to obtain a hospital card? After obtaining the card, wait another 30 minutes to see a doctor. How did these waits make you feel? What if I told you you could consult your doctor on your mobile device for non-life-threatening conditions anytime, anywhere? Wouldn't that be great? How, you ask? By registering at www.KompleteCare.com. This registration is free and simple. You not only get to consult a doctor on your mobile device, but can book appointments to see your doctor at the hospital. Better still, you could have your doctor visit you at home. Isn't that wonderful? Enter your details here and experience the easiest and fastest access to a doctor or hospital. Do you know that this reduces the cost of you consulting medical experts and the logistics of doing so by 30 to 70%? Do you know that this reduces the time you spend in hospital to the barest minimum and gives you time to attend to other things? Do you know that you can pay online when you need medical care and enjoy the best of medical care from qualified medical doctors from anywhere and anytime? Hurry now and register and benefit from cutting-edge healthcare revolution in Nigeria.
All right, good evening, everyone. Good evening. Thank you for joining us this evening. We're so sorry for the delay. We had some technical glitch. We're so sorry for the delay, for the time delay. We're glad to have you join us this evening. Welcome to Complete Care's webinar series. So the webinar series today is to celebrate the World Hypertension Day with the theme Measure Your Blood Pressure, Control It, and Live Longer. So the theme primarily speaks to controlling our blood pressure and how we can live longer while we control our blood pressure. So welcome once again to our guest. Welcome. Thank you for joining us this evening. Also sorry once again for the delay in the time. We had some technical glitch. So I'll be introducing us to our webinar, which is to celebrate the World Hypertension Day once more. And I would also like to introduce Complete Care to us. This webinar was brought to us by Complete Care. Complete Care is a digital health marketplace that connects patients with doctors and other healthcare professionals within the shortest time possible. Complete Care is your sure health plug for convenient, affordable, and quality healthcare. Thank you for joining us once more. And this evening, I would be welcoming our guest for today. Welcome, Dr. Temitope Oyetunji. She's a senior registrar, and she would be our guest for today. She will be taking us through the webinar session for this evening. Thank you for joining us, Dr. Temitope.
Have you ever visited a hospital and spent more than 30 minutes waiting to obtain a hospital card? After obtaining the card, wait another 30 minutes to see a doctor. How did these waits make you feel? What if I told you you could consult your doctor on your mobile device for non-life-threatening conditions anytime, anywhere? Wouldn't that be great? How, you ask? By registering at www.KompleteCare.com. This registration is free and simple. You not only get to consult a doctor on your mobile device, but can book appointments to see your doctor at the hospital. Better still, you could have your doctor visit you at home. Isn't that wonderful? Enter your details here and experience the easiest and fastest access to a doctor or hospital. Do you know that this reduces the cost of you consulting medical experts and the logistics of doing so by 30 to 70%? Do you know that this reduces the time you spend in hospital to the barest minimum and gives you time to attend to other things? Do you know that you can pay online when you need medical care and enjoy the best of medical care from qualified medical doctors from anywhere and anytime? Hurry now and register and benefit from cutting-edge healthcare revolution in Nigeria.
All right, welcome. Okay. Good evening, our viewers. Thank you for joining us this evening. We're so sorry for the delay. Um, this is due to some technical issue and glitch. We're so sorry. And thank you once again for joining us today for our webinar series. Welcome to Complete Care webinar series, which is to celebrate the World Hypertension Day with the theme Measure Your Blood Pressure, Control It, and Live Longer. So, the theme primarily speaks to controlling our blood pressure and how to live longer while we control our blood pressure. Welcome once again. So, before we go ahead, complete our webinar is brought to us by KompleteCare. KompleteCare is the digital health marketplace that connects patients with doctors and other healthcare professionals within the shortest time possible. KompleteCare is your sure health club for convenient, affordable, and quality healthcare. Thank you for joining us once again. Welcome, Dr. Temitope Oyetunji.
Thank you. Thank you very much.
Thank you for joining us this evening. Dr. Temitope Oyetunji is a senior registrar and she'll be doing justice to our topic for today. So we'll go straight into the business for today, which is to proceed with our questions. So the first question we have here is what causes hypertension? So Dr. Kumitoka would like to ask you what causes hypertension?
Okay, thank you very much. Okay, so before I answer that, we would have to define what hypertension is. So hypertension simply is elevated blood pressure. So that's raised blood pressure. So that is what hypertension is. And when you want to talk about the cause, they can be divided into two. We have to talk about the essential hypertension, which is what is common in older adults. And that one, there's no identifiable cause for that type of hypertension. But then you also have the secondary hypertension, which has some known causes. For example, some thyroid problems, you can have adrenal problems, even some drugs, illicit drugs, substance use. These things can cause secondary hypertension. So to answer the question, it depends on the type of hypertension. For essential hypertension, there's no identifiable cause usually. But for secondary hypertension, there are some causes which are the ones I've listed. So essentially, those are the causes of hypertension. Can you hear me?
Hello, ma. Yes, ma.
Yes.
So thank you
Did
very
you did
much
you
for
hear
the
that?
answer.
Did you hear what I
Yes,
just said?
yes. So our next question is what is the significance of the World Hypertension Day and the theme of this year's event?
Okay, so the World Hypertension Day essentially is just usually we have things like Mother's Day, Father's Day, and all these days are actually supposed to create awareness about hypertension, about the causes, about how you can measure your blood pressure, how you can control if you have hypertension. So essentially, World Hypertension Day is specifically the accurately, making sure that we measure the blood pressure accurately. So that is what the. Am I still audible?
Yes, ma.
Okay, so that is what this year's World Hypertension Day is all about. So it's about creating awareness and making sure people measure their blood pressure accurately.
All right. Thank you for the answer. So the next question is how would I know if I have hypertension? Maybe are there some symptoms? Are there some signs I'm supposed to see or to observe? How would anyone know if they have hypertension?
Okay, yeah, that's a very good question because hypertension really it has been called a silent killer because it doesn't really show symptoms. Most times you don't know that you have hypertension because there are no symptoms. And so to answer your question, the way to know if you have hypertension is to get your blood pressure checked. So that is the only way you can be certain. You can be fine with no symptoms and you can have hypertension. So the only way you can know if you have hypertension is to check your blood pressure. And a good thing about hypertension as compared to other non-communicable diseases is that it takes a very non-invasive test to detect it. Now, if you want to detect things like diabetes, at least you have to get a needle prick at least. Then for other cancers and all that, you may have to do, more invasive tests. But for hypertension,
Yes.
it's a non-invasive, simple test. So you just need to get your blood pressure checked, and that is how you know if you have hypertension or not.
All right, thank you for the answer. So, apart from there are no other symptoms, maybe some people can say, am I sweating too much or am I peeing too much? The major test to know if you have this is to check your blood pressure. All right,
Yes.
all right, thank you for the question, for the answer. I mean, so what causes hypertension? Okay, now we
Yeah.
already know how to check it, how to know if you have it. What causes it?
Yes, like I said earlier, we have talked about the types of hypertension and the causes of each. So there are some risk factors. Let's just talk about the risk factors. There are some risk factors that can predispose to hypertension. Now you have family history, which is very important. When there's a family history, that means the person is already genetically predisposed to developing hypertension. So when somebody has a family history of hypertension, they are at risk of developing hypertension. Then there are other things that can predispose to hypertension, like obesity, physical inactivity, um, diets, so a high salt diet, all these things can predispose to hypertension. So to answer your question, like we have said, the causes, it depends on whether it's primary or secondary. If it's primary, there's no identifiable cause. And if it's secondary, there are some causes like from the adrenal glands, from the thyroid, from the narrowing of the arteries, and all that. So and then there are some risk factors that can predispose you, like family history, like your diet, like obesity, like high blood cholesterol levels. So those are some of the risk factors that can predispose to hypertension.
All right. So to our next questions, what are the types of hypertension that we have?
Yes, we've already said that again. We have essential, and then we have secondary, essential or primary, and then we have secondary. So that those are the two major types of hypertension that we have.
Essential and secondary. All right.
Yes.
So I'll be asking you a question from one of the questions from our viewer. So this is from Mark Dannert, which says, rationale, what are the rationale for selecting antihypertensives?
Okay, so the rationale for selecting antihypertensives, it has to do with age, and then it has to do with race, and then it has to do with whether there are any other associated symptoms. Some people have heart disease, some people have kidney disease. So depending on all these things, that's how we determine which antihypertensive we are going to start on. For example, for those that are less than 60 years and they are of the black race and they don't have any other comorbidities or like kidney disease, then we can start them on what we call the calcium channel blockers, things like amlodipine, and then we can start them also on diuretics. So it depends on the race, the age, and if there are any other comorbidities. So, and that is why when you notice that you have high blood pressure, you should go and see a doctor. So the doctor will consider all those things and then they will determine which antihypertensive is good for you. And that is something that people should understand, that just because someone else is using a particular drug does not mean you should use the same drug. It might not be the appropriate drug for you. So that is why you should always, visit a hospital and let the doctor prescribe the right antihypertensive for you.
All right, thank you, Ma. Yes, sir. So I would go ahead to the next question here, which says, "What is the management plan for hypertension problems?"
Okay, so the management plan for hypertension, we have two basic management for hypertension. We have the pharmacological and the non-pharmacological. Now, the pharmacological simply means the use of medications, while the non-pharmacological means we other things apart from medication, like lifestyle modification. Now, for people that have pre-hypertension, that is when the blood pressure is between 120, 139 for the systolic, and 80 and 90 for the diastolic. Usually, we can prescribe lifestyle modification for them. So we'll tell them, okay, improve your diet, reduce the salt in your food, eat DASH diet, which is the dietary approach to stopping hypertension, eating fruits, whole grains, less fats, leafy green vegetables. So we tell you all that, and we tell you to increase your physical activity, do moderate intensity exercise for at least 150 minutes in a week. That's like brisk walking, 150 minutes in a week. And then we tell you to also lose some weight if your weight is not within the normal BMI. So those are some of the things that we would advise you to do. But in some cases, maybe when the person is already at maybe stage 1 hypertension or stage 2 hypertension, then we need to commence medications. So, and that is where that question comes in. Then we look at those guidelines and the person's history and the other conditions that the person has. That is what will determine which antihypertensive we are going to commence. So it's either we use lifestyle modification or we use drugs. And then it's also important to know that even if you're using drugs, you still need to practice those lifestyle changes, because even in addition to drugs, those can still help you to improve control of your blood pressure. So we call them the self-care practices that should be done in hypertension. They include taking medications, taking an healthy diet, doing physical exercise or increasing physical activity, reducing weight, and avoiding smoking and avoiding alcohol. So those are the things, those are the management options for hypertension.
All right, thank you so much for the extensive answer. So we have a question here from Miss Lola Olusanya, which says, "What about drug interaction in hypertension therapy?"
Okay, drug interaction in hypertension therapy. Although I don't really get that question, what she really means, is it as in hypertensives, two hypertensives interacting, or antihypertensives interacting with another drug that the person is using? But let me just say that it's possible drug interactions can occur. But again, that is why you have the doctor. If it is prescribed by the doctor, then the doctor will make sure that whatever medications they are prescribing for you, they don't oppose each other or they don't interact adversely with each other. So that's just what I can say about that. And then when somebody is on antihypertensives, the doctor also will consider other drugs that they are using, maybe for other conditions. So they will be able to consider that so that they can choose drugs that will not adversely affect each other.
All right, thank you, Ma. So before we go on, I would like to bring welcome our viewers once more and share with them that this webinar is brought to us by Complete Care. And Complete Care is a digital health marketplace that connects patients with doctors and other healthcare professionals with the shortest time possible. Complete Care is your sure health plug for convenient, affordable, and quality health care. Thank you once more for joining us this evening. So I would like to take one more question from our viewers. This is from Rekia, which says, what is the new guideline for the treatment of hypertension?
Okay, so there are numerous guidelines for the treatment of hypertension, but for the JNC 8 guideline for hypertension, like I've said, is the one I referred to earlier, and is the one that says that when you commence medications at BP of 140, greater than 140/90 in people younger than the age of 60 and greater than 150/90 in people older than the age of 60. And then the agents that you will use will be determined by the race, the age, and then the presence of other comorbidities. So that's essentially the guidelines for treating hypertension or for initiating therapy for hypertension.
All right, thank you. So we're moving to our next question, which is, hypertension affects all age groups.
Yes, it does. Hypertension affects all age groups, although it's commoner in adults, in older adults, especially essential hypertension. But for secondary hypertension, you can have that in any age group. So even children can have hypertension if they have, some tumors, some kidney tumors or coarctation of the aorta, they can have hypertension. So yes, it can affect all age groups, but it's commoner in older adults.
All right, so we have a question from Evan Promise, which says, can hypertension be inherited? And if someone has a history of that, is there a way to avoid it or stay free from it?
Okay, yes. There's a genetic predisposition to hypertension, like we have said. So yes, inherited. And if someone has the family history of hypertension, what the person needs to do is to make sure that they check, number one, check their blood pressure regularly, and then adhere to all these lifestyle modifications we were talking about. That is taking care that they eat the right diets. That's a low salt diet, green leafy vegetables, avoiding fats, trans fats, saturated fats. So, and then exercising, making sure that they exercise, making sure that they have the ideal weight. So those are some of the things that avoiding smoking, avoiding alcohol. So those are some of the things that anybody with a family history can do to prevent
Wow.
hypertension.
All right, thank you, Ma. So the next question here says, what dietary changes does one need to make the or recovery? What dietary changes do one need to make during treatment or recovery?
Okay, so the dietary changes is what we have been talking about. So the major dietary changes that one needs to adhere to is the dietary approach to stopping hypertension, and that includes a low salt diet, intake of leafy green vegetables, whole grains, reduced saturated fats. So those are some of the things that one needs to do as part of the dietary modification in hypertension. So essentially, one has to follow the DASH diet. So that is the dietary, and it's like the question said to recover from. That's I want to point that out from there that actually you don't recover from hypertension. It's a chronic illness. So this is some of the misconceptions that people have. And they think that maybe after a while of taking their drugs, maybe they can be cured. But that is not actually the truth. So it's a chronic illness. So this is something you have to continue to do. So the dash diet that we're talking about is not something that you do for just a while and then you recover. It's something that must become a lifestyle. So you must continue to do, if you're on medications, you must continue to take medications. And if you're on medications, you must still
Ma-
continue to adhere to these dietary changes as well. So it's a continuous thing.
All right, thank you so much. So I'm going to take another question, which is from Lion Ishak Ajibola, which says the new trend in care. What are the new trend in care of hypertension and renal diseases? Yeah.
Okay. Yeah. So renal diseases is a cause of hypertension. Is a cause. I mentioned it as one of the secondary causes of hypertension. And like I said earlier, also when you're treating hypertension, you have to consider other comorbidities that the patient may have. And one of them is chronic kidney disease. So in chronic kidney disease, what is the guideline about that is that you use an agent. You use either an ACE inhibitor or an angiotensin receptor blocker in that kind of patient. So that is the agents that you use in chronic kidney disease. So to manage their hypertension with the chronic kidney disease that they have, you have to use those agents. Those are the ones that are specific for people that have chronic kidney disease.
All right. So thank you, our viewers, for joining once more. I would also like to let you know that this webinar is brought to us by KompleteCare, which is a digital health marketplace that connects patients with doctors and other healthcare professionals within the shortest time possible. KompleteCare is your sure health plan for convenient, affordable, and quality healthcare. Thank you once more for joining us this evening. So we're proceeding to our next question, which says, what is the role of care providers in the treatment and prevention of hypertension?
Okay, so the role of healthcare providers. Now, this is one of the role of healthcare providers that we are doing here today. Awareness, creating awareness, for people so that they know about hypertension, they know what it is, they know how to detect it, they know what the treatment options are. So creating awareness about the condition is very important because not everybody will come to the hospital. But now we are bringing the information online where the people are, so that people can know what hypertension is. So that's number one role of healthcare providers. Another role is screening of people whenever we have the opportunity, because that is how you get to detect those who have hypertension. You know that when you go to the hospital for any reason, they check your blood pressure. And that is one of the ways that we are able to screen people and detect those
Blood
who have
pressure.
hypertension so that we can, treat them, we can educate them about it, we can tell them the management options, and we can treat them. So screening is also one of the roles of healthcare providers. Another one is treatment, treating those that we have detected. And then, even apart from treating the hypertension, we still treat complications because no matter how much we treat, there are still people who come down with complications of hypertension. So, still at that stage, we can still come in and still treat even those complications, those that come down with heart failure, those that come down with stroke, kidney disease. So we still have a role in treating those complications. So essentially, those are the roles of the healthcare provider, starting from prevention, creating awareness, telling people to eat right, to exercise, to stop smoking, to stop alcohol or reduce alcohol consumption. So these are the things that we do to help prevent and then to treat hypertension.
All right, thank you, ma'am. So please, viewers, if you have questions for us, you can drop them in the comment section in the chat function. So we'll be proceeding to our next question, which says, what kind of support does a hypertension patient need?
Okay, so an hypertension patient needs support from the healthcare providers like we have talked about, and then they also need support from their friends. So the family members, they can play a role. For example, if patient has just been placed on medication or in some medications, they can play a role in reminding them to take their medications. And then they can also play a role in helping them to be adherent to lifestyle changes. Now, for example, we have said somebody that is
Okay.
hypertensive should eat low salt diet. Now, if they are in a family and they are eating from the same pot, now the family may have to make some sacrifices and also eat low salt food because of the person with hypertension. So those are some of the things that the family can do to support them. Then we said they should engage in physical exercise. The family also can, maybe go with them on brisk walks and things like that. They can help them to adhere to all these lifestyle changes. So essentially, those are the supports that a person with hypertension needs, especially from their family members.
All right, thank you, ma. So, what advice do you have for young ones or for youths, just to let them know about this hypertension and what they can do to prevent themselves, what they can do to avoid having this?
Okay, so my advice would be that everyone should get their blood pressure checked. That is the starting point. Okay, so the first thing is to make sure you get your blood pressure checked, and then you should also do that regularly. Get your blood pressure checked regularly. And then not only you, but also everyone around you. We all have parents. We have just said that it's commoner in older adults.
Yeah,
So you
older
should
people.
also exert awareness to, even if you check your blood pressure, it's okay. You also can, tell your parents to also check their blood pressure, tell your friends to also check their blood pressure. And then if you notice or on checking, if the blood pressure is high, most people, they ignore their blood pressure. Even when they know that it is high, they have this belief that, okay, maybe it will go down on its own, or it was stress that caused it. People come up with so many reasons why their blood pressure is high, and they don't
Reasons.
do anything about it. They don't take medications, they don't do all that. So if you notice that your blood pressure is high, the best thing is to treat it early and to control it so that you prevent complications. It is very important. So if I would advise people, that is what I would advise them. Number one, check your blood pressure regularly. And then when you notice, or if you have noticed that your blood pressure is consistently high, that is above 140/90 on at least two occasions, then you need to pay attention to it and take your medications and adhere to lifestyle changes in order to prevent the complications of hypertension.
All right, thank you, ma. So we have a question from Miss Mopilola Olusoya, which says, "What are the dangers of self-medication and other drugs in hypertension management?"
Okay, so generally, even not specific for hypertension, generally when people take drugs, when they self-medicate, there are dangers about that. And like we said earlier, for hypertension too, we have said that you shouldn't just use a drug just because you see that somebody else is using that drug. because there might be another drug that will be better for you
Yeah.
based on, other things that the doctor will consider. So it is very dangerous for people to just on their own just start an antihypertensive or just take their attention drugs with any other drug or even other medications. So it is dangerous. So I wouldn't advise anybody to do that. If you know that, if you have found out that your blood pressure is high, then the best thing is to go to a doctor and let them be the ones to commence you on the right medication and get to those medications. And even add that medications to those medications, you should also consult your doctor so that they can advise you on that.
All right, thank you, Doc. So I'll be asking you one last question. So, for a patient for someone, how are you to know if your blood pressure is very high? Okay, are there some symptoms you will see? Are there some feelings you're going to feel, or is there something that will just let you know that it has gone beyond the level you're supposed to go to? So, what are the symptoms or signs you to see?
Okay, so in some cases, when the blood pressure is very high, some people can present with headaches, shortness of breath. Some people complain of shortness of breath, dizziness. Yeah, so some people even may present with transient ischemic attacks. They can feel weakness. That is when stroke is already setting in. They can feel weakness, they can feel numbness, maybe on their face or on their arms or one side of the body. So those are some of the things that can point to the fact has a very high blood pressure. But ordinarily, like we have said, it's hypertension is asymptomatic, meaning that it doesn't show symptoms. But in some cases when it is very high, it can show some symptoms like the ones I've mentioned.
All right. Thank you very much, Dr. Temitope, for joining us this evening. So please, viewers, if you have any more questions you'd like to ask us, you can drop them in the comment section. And if not, we've come to the end of today's webinar series. Thank you, Dr. Temitope, for doing justice to the question we asked you. And I hope we've all learned one or two things to change our lifestyle, to always check our blood pressure anytime we go to the hospital, and also work on ourselves so that we're always at alert to know that our blood pressure is on the right range and our health is okay. So thank you very much. Thank you, Doctor, for joining us this evening. We'll be seeing again next time on our next webinar session. And this webinar series once more is brought to us by KompleteCare platform. Thank you. And have a good night's rest. Thank you, Dr. Temitope.
Thank you for having me.
Have you ever visited a hospital and spent more than 30 minutes waiting to obtain a hospital card? After obtaining the card, wait another 30 minutes to see a doctor. How did these waits make you feel? What if I told you you could consult your doctor on your mobile device for non-life-threatening conditions anytime, anywhere? Wouldn't that be great? How, you ask? By registering at www.CompleteCare.com. This registration is free and simple. You not only get to consult a doctor on your mobile device, but can book appointments to see your doctor at the hospital. Better still, you could have your doctor visit you at home. Isn't that wonderful? Enter your details here and experience the easiest and fastest access to a doctor or hospital. Do you know that this reduces the cost of you consulting medical experts and the logistics of doing so by 30 to 70%? Do you know that this reduces the time you spend in hospital to the barest minimum and gives you time to attend to other things? Do you know that you can pay online when you need medical care and enjoy the best of medical care from qualified medical doctors from anywhere and anytime? Hurry now and register and benefit from cutting-edge healthcare revolution in Nigeria.